What about ARNI? Whether patients with, see, ARNI recommends, the brochure recommends that you should not start ARNI when their blood pressure is less than 110. So do we have any evidence that this new therapy of ARNI in patients with HFrEF, does it benefit patients who are on the border? For example, you have a patient whose blood pressure is of 100 millimeters of mercury. So should we start these patients on ARNI, or will they become worse on starting? So you look at this data, it says ARNI reduces the risk of CV death and hospitalization even on patients with low blood pressure. So your blood pressure is above 100 or around 100, you can, by taking all the precautions of reducing the diuretics, taking off nitrates, taking off calcium channel blockers, there, once you start them on ARNI, there is a 12% reduction in risk of CV death of heart failure hospitalization, even when your blood pressure is borderline. So the event ratio, you can see that sacubitril valsartan versus enalapril, all patients, whether their blood pressure was less than 110 or whether their blood pressure was more than 110, all of them benefited. Yes, if the pressure is in the range of 90, then you would be a little hesitant to start. But anywhere between 90 to 100, or definitely more than 100, you can definitely start on sacubitril valsartan and expect benefits to happen. What happens if they get hypotension? Well, the incidence of hypotension was less with ARNI as compared to the comparator drug enalapril. So you should not start getting worried that this is a more powerful drug, so I will have worse outcomes if hypotension occurs. Most of the hypotension episodes are either related to some form of fluid loss like dehydration, which if you manage properly, you will not have a problem with ARNI. You will still be able to continue it, maybe after breaking off for a couple of days. In fact, enalapril had worse outcomes in terms of hypotension. So ARNI is that way safer.